Whether you're a doctor, nurse, podiatrist, pharmacist, allied health professional, or a personal care attendant, you will continue to see more and more wounds in the patients you care for. And as the population ages, there will be more people at risk of wounds with delayed healing, like wounds from skin tears, which may be slow to heal. So in this video, we will be going through the signs and symptoms and the best management for skin tears. A skin tear is an acute wound caused by shear friction or blunt force resulting in the separation of the skin layers. It is a major type of acute wound in the aging population and has a high risk of delayed healing. Why is this? Well, this is because as we age, our skin becomes thinner, slower to repair, and more prone to injury. The main causative factor is trauma from knocks, bumps, and falls around the house, especially to arms and legs. This wound type can be prevented by using padding on objects that are causing skin tears, like the edges of furniture, and by using protectors on the limbs of the elderly. There's also good evidence that the use of a moisturizing lotion twice a day can reduce the incidence of skin tears by up to 50%. Likewise, drinking fluids and a nutritious diet will help create optimal skin condition. But once a skin tear has occurred, how do we classify the severity? There are several ways we can do this. However, one example from the ISTAP classification scale is the following. Type 1. No skin loss. This is when there has been a linear or flap tear which can be repositioned to cover the wound bed. Type 2. Partial flap loss. Partial flap loss is when there is a tear present which cannot be repositioned to cover the wound bed. Type 3. Total flap loss. This type of skin care would expose the entire wound bed. So once we've become exposed to a skin tear on a patient, how do we manage this? Well, skin tears can bleed a lot, so start by placing a sterile or clean cloth over the wound and hold until bleeding ceases. If possible, depending on the severity, reposition the skin flap back into place. Using a cotton bud to roll back the skin can help. From there, we should dress the wound with a sterile, non-stick dressing, and if feasible, it's best to bandage the dressing rather than using adhesives on the skin. As a general rule, do not use any adhesive products on the fragile skin, and always place an arrow on the dressing in the direction of the skin flap so that when it's time to remove the dressing gently, it can be done in the direction of the skin tear, as doing it in reverse may reopen the skin tear. If the skin tear is becoming larger or not healing, then complete a comprehensive assessment of the person and their wound to ascertain any underlying medical concerns that may hinder healing. One way to do this is to use the HIDE mnemonic: history, examination, investigation, diagnosis, and implementation. So while not all healthcare professionals will pursue specialist knowledge and skills in wound management, it's crucial that you know what signs to look for to judge the severity of a skin tear and what the best way is to assist and treat your patients from there. Because at Wounds Australia, we are dedicated to reducing the harm caused by wounds through educating and supporting healthcare professionals and students. For more resources on wound management, including publications, online learning, e-magazines, journals, conferences, seminars, and wound management courses, visit www.woundsaustralia.com.au.